Dr. Jonas Apostol. So hi guys, so welcome to another vlog, no? So it's been a while. Anyway, so I'll be presenting this case. Actually, medyo kilala nyo to if you are mahilig kayo mag-TikTok. He is a TikTok star. So his name is Simon. Okay, si Simon maganda yung mga content niya and is really very energetic. Si Mr. Pure Energy. So, may sa aming TikTok na ginawa na nag-viral. Pero actually, medyo nagulat talaga ako noon, unexpected, kasi akala ko, alam mo yun, may gagawin lang kaming something, pero it's unexpected. So as you may notice sa mga video ni Simon, okay naman yung ngipin niya, medyo yellowish lang. But the main problem here is the health of the teeth, okay? So we have to remember that when we do our smile makeover thing, we have to make sure that the teeth are healthy, it's functional, and lastly, it is beautiful. So if you take a closer look, you may notice that the shades are uneven, okay? And he's not actually aware that he is wearing a direct composite veneers. Hindi nasabi sa kanya. So possible na mention sa kanya, pero siguro nakalimutan niya na lang. Also, the problem here is the gingival architecture. As you may notice, hindi siya balanced and symmetrical. That's why we have to do something about the architecture of the gums as well. So in smile makeover case, we have to make sure that we properly assess everything by getting all the diagnostics. We have the diagnostic cast, we have the photography. We also need to have x-rays to be able to ensure the health of the teeth and also the supporting structure of the teeth and the gums. That's why we have to make sure that everything's fine and everything's okay before we can go straight to smile transformation or like the veneers. So we found out that there are a lot of teeth involved that requires root canal. Why? Because the damage is already extended on to the pulp area and it requires an attention with our endodontist, specialist in the pulp, no? They're the one doing root canals. So after we have resolved the issue with the health of the teeth, then that's a time that I started creating the build-ups and the preparation for his brand new smile. So it's a combination of veneers and crowns. So people always ask us about the steps in doing smile makeover, no? Number 1, smile design. In smile design, restoration, no? Tapos natapala na. Okay? Pero design pa lang, anything can change. Habang tumatagal, mas ma-notice mo na mag-iiba yung I make sure that I create something beautiful, okay? I'm using a composite material designed directly in the patient's mouth. In that way, it is more predictable and there is no guesswork for the possible outcome. So in smile design, we can also make sure the shape of teeth and the length of the teeth, the thickness, and most importantly, the shade or the color. Okay? So doon pa lang, nalalaman na natin. But it's not like 100% guarantee. We have this blueprint for your future result. Number 2, okay, that's the time that we prepare your teeth, okay? And doing the veneer preparation, we have to make sure that we remove all the unsound structure. Yung lahat ng mga cavities, tanggal yan.
12 PM na, isipan ko gayahin yung ngipin ni Sasa Girl. Nandito tayo sa Apostol Dental kasama si Doc Jonas. Grabe, sana all pogi yung doktor. Medyo kinakabahan ako kasi ngayon lang ako nagpa-dentist. Takot pa naman ako sa injection. Nakasampung anesthesia ata ako pero di naman masakit. Ako na si Sasa Boy in 3, 2, 1. Wow, grabe ang pogi ko. Kaya naisipan ko mag-shades kasi ang ganda ng smile ko. Joke lang.
So kung gaano kalaki yon, yung preparation, nakadepende din sometimes sa laki ng sira. Okay? It's not just about the design. So with this case, it's a combination of veneers and crowns, no? Ang daming naka-root canal, so medyo aggressive yung preparation because we have to remove all the unsound structure and also we need to build up the teeth para we have a good base for durability and it can withstand with the forces during mastication. Okay, so why veneers and crowns? For the crowns, especially for the root canal treated teeth that has lost a lot of sound structure, it requires crown kasi para mas durable, mas tatagal, okay? Longevity. So from the outside, it looks the same. Sa back naman, doon na siya nagkakatalo minsan. Nagkakaroon kami ng extension sa lingual area, kina-crown, sometimes naka 3/4 crown, sometimes naka-veneers. So, depende. As much as possible, I really want to give the patient a minimally invasive procedure na restoration so that if there's any problem in the future, we can easily access the lingual area for possible root canal kasi hindi naman lahat ng ngipin niya na root canal. Third, temporization. Okay? So after the preparation, we have to make sure that we have a good sets of temporaries. So in this case, ni Simon, I placed in a little bit whiter shade kasi he requested for a whiter smile. But when I first saw him, sabi ko, si Simon deserves to have a white sets of teeth kasi bagay sa kanya in terms of personality. Super bagay sa kanya. Tapos smiling face pa siya and I like the color of his gums and a white sets of teeth would really make a difference to him. So, yeah. Sa temporary pa lang, puti na. So, iba natatakot with the temporary, baka hindi sila makalabas. But as you can see here, pwede na pang rampa. Fourth, fabrication of the ceramics. So, we have an in-house laboratory wherein I have the command to my ceramist for the type of restoration I'm given to my patient. So when it comes to like the thickness of the base and the layer, everything, the stain, everything that required to get the result that I want for Simon is being communicated to my ceramist. So I have a team and everything is smooth done. So the waiting time is around 7 to 10 days. I chose lithium disilicate or Emax Porcelain for Simon's case. Why? Because yung porcelain kasi it's translucent, no? So we can be able to see through what's inside. So based on the preparation naman, there is no discoloration, thank God. Kasi mas mahirap yon to mask. Sometimes for that case, I use zirconia. But for his case, Emax Porcelain would be ideal. Fifth, try-in. So in try-in, we are... try-in tayo. So in doing try-in, we have to remove the temporaries first, no? And then we clean the teeth. Tapos nun, we place in the final ceramics.
Kinabit ni Doc Jonas yung ngipin ko. Grabe. Ang galing gumawa ng doktor ko. Woo! Grabe, the best talaga ang Apostol Dental.
Siyempre, tinitingnan ko yung fit, kung perfect na ba. Kasi dapat maayos. It should look like a natural teeth. Tapos, in harmony sila lahat. So, if there's no problem, then doon natin siya kinoconsider na isa-cement. But, before we do that, we make sure that everything is in harmony. No? So, ganun yung try-in. Sometimes mabilis, sometimes matagal. Sixth, so if try-in goes smoothly, then that's the time that we will clean the ceramics, clean the teeth, and then we will prepare the teeth for the final cementation of the Emax porcelain. So for the actual cementation procedure, it requires like around an hour, no? It includes cleaning everything. and flossing, lahat-lahat na yon.
1 week later.
7th, so after a few days, like a week, then the patient is required to come back to our clinic for the another cleaning and equilibration. We run it with our T-scan, and lastly, we give the patient night guard. So here is the result. As you may see, it's whiter, it's brighter, and equally distributed. With this case, we are going to do not just the upper teeth but also the bottom. So kailangan natin gawin also para mas maganda yung lower. So the shade I selected for his case is BL3. It's white but super bagay lang sa kanya yung shade na ito. So what changed from Simon's before teeth to now? Number one, the shade of the teeth, no? It's way more balanced, whiter, brighter, and mas maganda na sa kanya. Especially with the, the skin tone, nagbalance talaga, and the personality as well. Second is the shape, the morphology and anatomy of the teeth. I've enhanced it as well. And thirdly, the gingival architecture has been changed. Also, the health is very, very important. It's healthier version of his teeth and also more durable na this time. And as you may notice, okay, nag-glow talaga si Simon. I mean, bagay na bagay. Itong shade na to, hindi lang siya para sa ngipin lang, but also for the entirety of the face. So, So Simon and I talked after we've done with the veneers, no? Iba talaga ang nagagawa ng smile transformation na to. It's not really about the veneers itself or the crowns. It's more of like you having that confidence from within, from the inside, na alam mo na you have a nice set of teeth, healthy, functional, and also beautiful. Kasi sometimes we don't see these things tayo mismo. Hindi natin nakikita na they're actually suffering from this kind of insecurities. Pero once, they were able to deal with that, parang mas nagiging more sila in life. So I'm really excited for Simon's future. Kasi this kind of treatment can give Simon better future or something like that. It's because na-deal niya yung problem na to from within So, sometimes kasi it's not just about the treatment itself, but also yung tapang na kailangan for this kind of treatment. Kasi sometimes na ang daming gagawin pero natatakot ka baka hindi siya effective or it might fail. Pero sometimes it requires courage to the individual to undergo with this type of enhancement or procedure. So it's not just about the beauty, it's about the health and about you in general. So yeah. Bye guys. So that's it. See you again for the next vlog.